Good morning, everyone. Hope you're well. Welcome to day 24 of our COVID-19 live updates from Vine Health. This is being done to present you with some facts over the last 24 hours and not fiction. So I'll stay away from anything that is not true. So you get only the truth here. And also to help you live sort of healthy lives during this time and beyond, and to help you not just survive the pandemic, but to thrive in it and to put things in perspective. It helps you as much as it helps me. So hopefully you will like, share, forward, just, let everybody who needs to hear this. So this is day 24, and what I really want to talk about today, again, towards the end, as I always do the topic towards the end, is about who is dying from COVID-19. Who's dying from COVID-19? Is it more white people, black people? What demographic and why? This was triggered by a discussion yesterday that in America, in some states, over 70% of the deaths from COVID-19 are in black people. And that just made me very sad. So I'll talk about that towards the end. So in the last 24 hours, what's happened? Well, I thought that Nigeria was going to report no cases, but unfortunately, we've had even more cases picked up in Nigeria, and it's now gone up to 254, the total cases. But more people have been discharged and have recovered from it. So 44 people have been discharged, and the total deaths so far are about 6. And all of those people are people who are very, very vulnerable, so with multiple illnesses, and some people have had transplants and really ill. So it doesn't make it any better, but just to say that Nigeria is still on a good trajectory. Across in the United Kingdom, obviously, it's more, it's just increased again. Although the positive thing about the United Kingdom is that the number of positive tests is dropping. So we're hoping that over the next few weeks that would mean that less people get more sick and less deaths. It's very disheartening. It's very tough, but this is what it is. The Prime Minister is still in the hospital, and we haven't really heard any further news apart from the fact that he's on oxygen. So we'll keep waiting and wish Boris Johnson all the very best. The number is really interesting how Italy has over 17,000 deaths, and then Spain, and then the UK and the US, and all these countries are supposed to be the most developed in the West have so many fatalities from this. And China, where it started from, are still reporting 3,000, just over 3,000 deaths. And it's really mind-boggling. And for me as a scientist and someone who believes in evidence, I really can't wrap my head around how this has happened. So this is something that we'll be studying, I'm sure, for years to come, as to how this has happened this way. And I can see why the conspiracy theorists find a lot of material to supply their conspiracies, because the numbers just look very, very odd, and you just can't really sort of explain it. But this is what's going on across the world now. So we just keep on hoping for the best and keep staying strong. Do the best that we can to be healthy and stay healthy, and just reduce your chances of contacting this virus. The other thing I was going to say was just because I titled this COVID-19 updates, and I'm sure I explained the difference between COVID-19 and coronavirus at the beginning of this update. But just to say again that COVID-19 just means coronavirus disease. That's the disease that you get when you sustain this coronavirus. And this coronavirus is a group of viruses that look like they have like crowns. So corona just means crowns. And really the real name of this virus is now SARS-CoV-2. So CoV-2. So SARS-CoV-2. And it just because it causes a severe acute respiratory syndrome. That's what the SARS stands for. And then coronavirus CoV and 2, because we've had a first one a few years ago. So I hope that makes it a bit clearer. But again, we use it interchangeably, coronavirus and COVID-19. People that are positive for coronavirus don't necessarily go on to develop COVID-19, the disease itself. And 19 just means 2019, because it started in 2019, December. So I hope that explanation is useful. Now, I want to talk really about who is dying from COVID-19. Dr. Anthony Fauci, is it Fauci or Fauci, who's the director of National Institute of Allergy and Infectious Disease in America, was saying that unfortunately we have Black people disproportionately dying from COVID-19. This is attributed to all sorts of things, and Trump came in and put his own his own opinion on it. This is usually, according to what he said, is because Black people have a whole lot more of the underlying chronic conditions that cause them to have a poor outcome when they have COVID-19. So that's what he said. They also mentioned the issue of poverty in the Black community, causing more Black people to die. And in some states in America, over 70%, as I said, are Black people that die from this. And it made me look at the people who are dying from this. And I've requested a breakdown again from our Department of Health and Social Care here as to the race breakdown of who's dying from COVID-19. But I know that in the medical profession, as far as I'm aware, all the doctors that have died so far have been from Black and minority ethnic origin. So obviously we've had a Caucasian nurse and I think a Caucasian midwife. The question to me is, why is this the case? Is it truly because we have more underlying conditions? So poorly controlled diabetes, poorly controlled hypertension, obese, so fatter than everybody, other people. So, and then we also, I know for a fact that a lot of the transplant patients are also Black. So this is very sobering, and the Black community, and this is one of the reasons why we've been talking about I've been talking about health for a long time in the Black community. It is very sobering that if this is the reason why over 70% are dying from that are dying in America in some states are Black, then we need to really, really start to think about the way we approach our health, particularly the Black people that live in diaspora, or the Black people that have always known the West as their homeland. So this is so important. So if you're a Black person, you're listening, I think the onus is all on us to start to change the story. Every one of us is in the business of health, because without your health, you cannot do anything else. You really can't. So let's take this business of health very, very seriously. And this data should be coming out from our community. We should be talking a whole lot more about this. So poverty, poor health, this is time to take control. And so that when we get illnesses, we don't disproportionately die from it. I mean, when I heard Trump saying yesterday, oh, it's very, very unfortunate, very, very unfortunate, very unfortunate. But this is the story of what's going on in many parts of the West. The people who are Black have poorer health outcomes than those who are white. That is not acceptable. I am very passionate about doing all that I can to spread the health message, but every single one of us has to take charge of their own health. Make sure you weigh yourself today. Do not be overweight. Do not be overweight. Your BMI should be within the normal range, and do all that you can to keep it in the normal range. It's hard, but it can be done. Exercise has to become our culture. Check your blood pressure today. Check whether you have diabetes today and get it treated. Take your medication every day so that your body is in the best fighting form to deal with disease. All that being said, there's nothing that is promised. I'm not saying that, oh, well, if you do all of that, then everything will be fine. But yes, there's a better chance, according to science, that if your body is in good fighting form, then things are sort of much better. Please, guys, I really just need some interaction. So send me any questions and we can discuss tomorrow. Any feedback, any comments. If you're in the Black community, or even if you're not, what is your observation? What do you think that people who are Black can do better? People of African descent, people who are of Jamaican, Caribbean descent. What can we do better to improve our health outcomes? And health is linked to wealth as well, because if you don't have the means to keep yourself healthy, if you're having to work 2, 3, or 4 jobs to sustain yourself, how are you going to be able to, do the things that are really healthy? So let's not let our story be like this, where people are talking about Black people and saying how poor their outcomes are. Let's change the story. It may not be possible to change it for this pandemic, but maybe the next pandemic, hopefully we won't have any more in the next 100 years, or for day-to-day living, So let's try. So that's my message for today, day 24, is that the pandemic is still going on. I know that the messages are quite sobering, but there is good news. There are things that you can do. Share a message with someone today. Speak to somebody about their health, about their mental health, about their physical health. Go for a walk. You're allowed to have one day. You're allowed to have one once a day to go out and exercise. So you can go out and exercise. Do some exercises at home. Keep yourself strong. Keep yourself in fighting form, and share the message. You can't do it alone. One person cannot change the message. I alone cannot change the message. We all need to come together as a strong force to change the message in our community. So thank you all for watching today. I really appreciate it. Share it with your friends, and I'll be back tomorrow, day 25, to give you some more updates, and just let's be positive. Have a great day, everyone, and bye-bye.